Good evening, I'm Maika Gigido and I will be performing how to put our patients in a postural drainage. So first is postural drainage is very important to our patients because it can help the patient to expectorate all the secretion that is in the patient's lungs, in the different parts of the patient's lungs. So it is very important. We are going to use gravity for the patient to expectorate all the secretions. So next is it is effective if the patient is at the position for 10 to 15 minutes. And then if we are going to exert also the combination of the position and also the chest wall vibration. And then next is when not to put the patient in the postural drainage are first is if the patient is feeling nauseous or about to vomit. Next is if the patient have any rib problems or any problems to postures. Next is if the patient is at full stomach, so the patient need to eat 1 hour before the procedure. And then next is if the patient can't breathe properly. So we can't do the postural drainage if the patient can't breathe properly. So first, let's go to the position number 1, which is the secretions from the top and front of the both lungs. So for example, the patient is lying supine like that. You need to put the patient, this is position number 1, you need to put the patient in a sitting position. You can put pillow so that the patient can sit properly. So position number 2, if the patient has any secretions at the top or at the back of the lungs, you can put the patient at the sitting position and put 2 pillows at the chest of the patient so that the patient is leaning forward. So for example, this is the pillow and another pillow. Next is position number 3, where there are secretions at the front upper portion of the both lungs. So put the patient at supine position, facing up, and then put a pillow under the client's knees for comfort. For example, like this. Next is the position number 4, which is the secretion of the upper back portion of the lung. So, ask the patient um, to go in the left side and then put a pillow onto the patient's chest and then put the feet bend to the pillow and then body slightly forward. Next is for the position number 5. So this position is for the secretion of the upper and back portion of the left lung. So put the patient in the right side and then put a pillow into the patient's chest and then make the patient's leg bend and then put the patient slightly forward. Next is the position 6 for secretion at the right middle of the lung. So you need to put the patients lie on the left side with knees bent and then put pillow at the back of the patient and then elevate foot or put if the hospital is there is no the bed can elevate, so we need to improvise. So we can put pillows under the patient's feet, so the patient feet are elevated. So is the position number 7, which is the secretions from the middle left lung. So we need to put the patients at the right side of the patient, and then put pillow at the back of the patient, and then put the patient knees bend, and then the patient's body slightly forward, and then elevate the foot of the bed at 15 degrees. Is the position number 8, which is the secretion is from the lower portion of the both lungs. Put the patient in the lying face up with pillow underneath, and then next is elevate the foot of the bed into 20 degrees. This is the position number 9, which is the secretion is from the back portion of both lungs. So put the patient lie down, facing down, and then put one pillow in the abdomen of the patient. Next is the position number 10, which is the secretions are from the lower back of both lungs. So put the patients at the lying face down, and then elevate the foot of the bed at 20 degrees. Is the secretions, position number 11. Next is the secretions that's coming from the lower back portion of the right lungs. So you need to put the patient at her left side. Then put one pillow on the patient's chest, and then with knees bend and body slightly forward, and then elevate the feet or the foot of the bed into 20 degrees. Next is position number 12, where the secretions are from the lower back of the left lung. So you need to put the patient at the right side of the bed, and then put one pillow on the patient's chest with feet bend, and then body slightly forward, and then elevate the foot of the bed into 20 degrees. So that's all for this postural drainage. So thank you.